I'm Dr. Patricia Dawson. I'm a breast surgeon at the Swedish Cancer Institute and a longtime advocate of women's health with a long interest, both personal and professional, in African American women's health. I got involved in this project as a member of the Community Advisory Board. This is my colleague, Dr. Fran Lewis, who is a nurse researcher and who is a strong advocate for women's health.
My name is Fran Lewis, and I'm an oncology clinical nurse specialist, and I'm also a scientist. In the course of sitting on a statewide committee for about 2 years, we discovered that there were a number of African American women who were eligible for free screening under the Breast and Cervical Health Program that, despite best efforts, weren't coming in. And these best efforts really were outstanding. So for a number of months, we got together with the Seattle-King County Health Department, Ellen Phillips Angeles, her epidemiologist Lynn Song, and we decided we would write a grant to try to discover and uncover what the feelings, beliefs, and issues were with the women that were not coming in. This study had never been done before. All the other prior studies had been always with women who delayed getting screened. More, we were interested in the women who were not coming in, who were making active decisions to not be screened. And what we found were a number of very unexpected results that we look forward to sharing with you.
The original project was expanded by the enthusiastic participation of the local Susan G. Komen Foundation. They thought the study was so important that they wanted to help fund a way to disseminate the findings. And so a communication plan was developed to reach out to both women who were potential women who would be coming in for screening and to healthcare providers. And the goal of that is to look at ways that we can reach these women and get them to be partners and come in for screening, and to reach healthcare providers and to help them understand what makes this group of women different from other women, and why is this approach different from the approaches that we've traditionally taken.
The initial Department of Defense study that gave us the ideas of what was happening for these women was a population-based study. Thanks to Lynn Song and the State Health Department epidemiologists, we were able to go and identify all those women from 1999 and forward who had made a choice to be outreach but not come in for screening. Saying it again, they had been invited for screening with free mammograms by a community worker, and they had made a choice to not be screened. Either they didn't come in for screening at all, or they came in to be examined but refused the mammogram, or they never came back once they had the initial screening. It's a very special subgroup of women. They were making a decision to not be screened. It took us over 2 years to find these women. Many of them were in shelters. Many of them had moved from place to place or house to house. Their phone numbers weren't working. Some of them had passed. When we found some of these women, they weren't comfortable with us talking with them in their homes. We met with them in restaurants or libraries, sometimes outside and outdoors in local parks. And they allowed us to tape record their answers to a set of questions that helped us understand what they were thinking and feeling about breast cancer screening. And we never asked them in a direct way, why didn't you get screened? No, we wanted to understand what it was that was their frame of reference. What was it that they were carrying that concerned them? What was it that kept them from making the choice to be screened? We discovered 12 major results, and part of this workshop will include details of that set of results. But let me just share a few examples of some of the things we discovered that run counter to what we understood. One of the basic assumptions of the Breast and Cervical Health Program of the United States is that mammograms allow for the early detection of breast cancer. It's probably the seminal assumption. And for these women that weren't coming in or made the choice to not be screened, they believed that it wasn't an efficient or effective way. They believed they knew their bodies more than physicians. They thought mammograms were unreliable. They couldn't be trusted. And even an extension of that was that they believed that often white providers were not to be trusted. And even some of them linked mammograms to the Tuskegee Institute experiments. Another assumption, that biopsy allows for the detection of disease at an early stage when caught. So we mostly thought that the biopsy process was diagnostically informative, and that would allow the physician, Dr. Dawson and others, to know, is this cancer that we're dealing with in this lesion? For these women, a biopsy caused problems. It caused problems in at least 3 ways. One, it always led in their eyes to negatives. It caused problems. And there were even people who believed that by opening up their body with the biopsy, they let air come in carrying the cancer into their bodies. Some women believed that if the cancer was in the breast and you cut it, it would spread the cancer. So again, the basic assumption that a biopsy was a diagnostically informing and helpful tool was not maintained in their belief system. And then just one more example. Again, there were many, many examples of these results. Another example is that the mammogram procedure is a simple step for screening and user-friendly. In the experiences of these women, some of whom you'll hear later, that has not been their experience. For those that did initially get screened but didn't come back, or had been screened a long time ago and never wanted it again, they likened the mammogram procedure and the compression to having their breasts pinched and wrenched and tortured in car door slamming. And it wasn't just a physical pain. For them, the way they were treated by the radiology technician, the way they picked up the vibes, their word in the reception office on how they were called out, they felt like second-class citizens, and there was emotional pain. And there were many stories that when they disrobed in order to have the procedure, that screening technician, in the women's views, dismissed them, looked at them in very negative ways, and it caused them emotional pain. Those are examples of what we found.
The findings that Dr. Lewis just described are so unique and exciting. They're very counterintuitive to what we believe to be true, that the communication plan was developed to disseminate them. And this is being done through written materials, through discussions, and through workshops like these.
The highlight of this workshop centers around women talking about their own beliefs and assumptions. One of the films that we've put together is not only a film for you as a workshop participant, but also another film for women functioning as community outreach workers to touch the lives of the women who decide to not be screened. And in the next few minutes, you're going to see 8 women talking about the assumptions that we discovered. It will show you in their own words, their spontaneous words, unrehearsed, totally unrehearsed, their response to the assumptions that we documented in the Department of Defense study.
I'm Karen, and 2 months ago I went in for a mammogram screening. A few days later they called and asked me to come back for another one. They told me they had seen some things and wanted to make certain everything was okay. But I'm a single parent with a young daughter, and I'm afraid to be sick. I know I should go. I tell myself I will, but I can't seem to find the time. My friend Betty leads a support group of women who help each other get their screenings, and today she's taking me with her to meet her friends.
My name is Betty, and I know Karen needs help to go back for her follow-up screening. I want her to come with me today
Well, hi.
and hear what my friends have to say.
You ready?
Yes, you ready to go?
How are you? I'm fine.
Hey.
Thank you. I'm a little nervous, but otherwise I'm ready.
All right.
Okay. Well, here we go. Thanks for inviting me. I don't know what to expect. Yeah, I'm a little nervous.
It's going to be good,
Well,
and you'll learn a lot. The women are loving together. Some of my friends are healthcare workers. Some have other jobs. Some are cancer survivors. And at our meetings, we talk about why people don't get screenings and what we can do about it.
Betty has told me that the women in her group have a lot of experience with screening and are very supportive. Still, I don't know anyone. And I'm a little scared.
We're here.
Well, hopefully they won't be too overwhelmed with me.
I'm sure Karen will fit in and enjoy herself. But there is one lady I am a little concerned about. We have a new person at our meeting today, and I'd like to introduce her. She's already introduced herself, but I would like to introduce you to Karen. She has come to our meeting today. She had went to get a mammogram, and she had a positive reading, and now she's afraid to go back to have another mammogram and get everything clear. So I brought her here so we could talk to her, discuss things with her about the mammogram, about medical and other things, so she would be more knowledgeable. And some of us, it will help us also. So I'd like for you ladies to talk to Karen and give her some information. Or Karen, you can tell us what your fears are.
Well, my first fear is the disfiguration. I'm not interested in having my breast cut off, nor am I interested in any changes to my physical body.
Well, wait a minute, Karen. Didn't you say they gave you a positive result?
They did, yes.
And now they want you to come back as a follow-up?
That's true, yes.
And you're afraid to go back?
Right. I've heard of incidences where, you know, women have gone back to get re-diagnosed and or confirm their positive findings, and before they know it, they're in surgery and they're having their breasts removed. Their husbands or their boyfriends are leaving them, and I'm not quite sure if I'm ready for that type of emotional setback.
Well, you look so young. I was just wondering what would have made you have a mammogram in the first place.
There's
Were
a
you
history.
having problems?
There's a history of breast cancer in my family, and my father also passed of cancer.
My father and mother did die of cancer, and I'm afraid of it. And I was about to tell a room full of strangers of my secret and biggest fear. I wanted their help, but at the same time, I wanted to run. I didn't want to hear what I knew they had to say.
And as far as disfigurement, wouldn't it be better? You really wouldn't be disfigured, but to go and discover if you are. You haven't really found out if you have cancer.
I don't want to know. I want to enjoy my life.
Well, Karen, don't be afraid to go back, because I've talked to many people and they were so afraid to go back because they think once they go back that they're going to find something bad. And I talked to a lot of women, scheduled a lot of women for mammograms and encourages a lot of women. And many times, about 95% of the time when people have to go in for second views, there's nothing wrong.
You had mentioned to us that your father had cancer, your mother had cancer, and you're afraid, but don't you think it's being selfish for your daughter? Because that runs in your family line, in your genes probably, and you need that mammogram for your daughter's sake as much as for your sake.
I'm a single parent, and I do have a concern about her watching me go through this. She's getting ready to graduate, and I don't want to put any more stress on her than what I deem necessary. and that's by my choice. I appreciate all the support in the room. However, the reality of it all is you all are working, you have schedules, you have families. People like to volunteer their services. However, when it comes down to the realism of stepping into an appointment, and you do pick up the phone and you call and say, I need some help, are you going to walk into that doctor's office with me?
If you don't make the decision to live for yourself, it doesn't matter how many times we go to the doctors with you. What value is life to you? You want to be there for your daughter. You're worried about how your guy is going to look at you or not look at you. What about you? What do you want? How do you want to live your life?
I live my life to the fullest already, and I don't want anything hindering that. And I feel that if I go in there, that I'm just starting a new job.
That is a
you
hindrance.
know,
That's a big old hindrance if you're not around to live it to the fullest.
And how can I actually ask for time off work if indeed something is wrong? And I'm just starting at this new facility.
Karen, what other things are you fearful of? Embarrassment or the medical, about paying for the medical bills? Because I think before we finish in here, we're going to be taking you to go get your other test. And I think you're going to agree with us and you're going to go along with it.
Well, I don't know. I'm real reserved about going to the physician in the first place because I've seen a lot of unnecessary changes in the black culture, being that when you go into a physician's office, you're treated differently. And another thing, my family. You know, everybody's always volunteering services. However, initially when you're diagnosed or when you're ailing or you're sick, where is everybody? You know, you're abandoned in some situations, and I don't want to have to go through that fear of being abandoned by my physician nor my family.
The first time Karen came to the group, she was filled with denial, the classic denials. Reasons why not going, reasons why she shouldn't go, reasons really why she wouldn't go. I wanted to help her, but I wanted to hear that she wanted to help herself. That's what I really needed to hear.
I know Doris and her story, and I was wondering how she and Karen would get along. I know that they are both very strong women, and I pray that there is no trouble. We want to get down to business and talk about the fears of mammogramming. We're going to talk about the medical, the doctors, and experiences that you've had. So, ladies, I'd like for you all to join in and give us some input on this.
Okay, so we do mistrust the medical community. We have reason to. I mean, we know about the Tuskegee experiments and the experiments on prisoners and things of that nature. But we have to move past that. We don't have to let that repeat itself. You can network and find good doctors, good clinics, good pharmacists even. I mean, at this point, we can talk among ourselves, and we have the world as a platform. If anything goes weird, awry, or doesn't feel right, not only do we have this group, but we have state agencies, federal agencies, and the world to let this information out to, and something will be said, something will be done. We don't have to suffer in silence.
But the reality of the matter is that we are treated differently when we go into these offices.
About that. I mean, we have options now. Right. One, we know medical doctors are not God. They may have portrayed themselves that way to us in the past through Marcus Welby or whatever, but they ain't. So what we can do now is go to these doctors' offices with friends, advocates.
And you don't have to leave it up to chance. And if you don't know a good doctor yourself, you know, you have to get in touch with other organizations that can help you to find a doctor that you can trust.
Historically, we have really good reason to not trust the system, but we have to move past that. If you feel weak about certain things, bring a friend that can speak on things. Don't bring someone just like you. You won't get much done. Get somebody a little bit different. You can go to more than one doctor. You have access to alternative practitioners.
For me, it feels like a war every time I go out to the community because I'm a single parent. You know, my daughter, I have to think about her. And it's always a fight, you know, and I'm tired of fighting. You know, it shouldn't be that way. So I'm intimidated and scared to really, you know, go back to find out what's there because I don't want to have to sit this child down because I am her mom, her dad, her grandparents, her everything, and tell her if I'm sick. Who's going to be there? What's going to happen to her?
Is it really about her, or is it about you, your inability to accept the news either way?
Actually, I've been encouraging my daughter to keep herself up as far as her mammograms because of the history. My mother lost 4 sisters to breast cancer, and I watched what they had to go through. Chemotherapy, ripped out their hair, you know, the surgeries, taking off breasts, and it still didn't help. They still died.
Yeah. Karen, can I ask you, you said you tell your daughter to go get a mammogram to keep up. How can you tell your daughter to do something that you won't do?
I knew the women were trying to help me, but I was beginning to feel trapped. Everyone, especially Doris, kept pushing me, but I still wanted to hear more.
Talking to my daughter last night about this subject, and she said she wouldn't want to know. I said, why would you not want to know?
I've heard people say that.
She said, because I have 3 children. She's just gone through a divorce. And she said, who would take care of my children? I said, well, who am I? You know, you have a mother. You have sisters. You have brothers. Any one of us would jump right in there and handle the situation. And you know that. So I said, if you needed to go for a mammogram, you should not be thinking about what's going to happen to my children. Mm-hmm. You should feel like your family, they love you enough to take care of that for you, to be there for you. Look for support instead of looking at barriers. Look at support that will knock down the barriers to keeping you from getting help for yourself.
I could see Karen was having problems. She was new to the group, and though everyone wanted to help her, I could see she still felt alone and frightened.
Reality speaks that there are incidences that occur in the physician's office with the technicians that create circumstances to keep our people, our women, from going in there and getting an exam. And that so happened to me.
My feelings about doctors are they're about the bottom line. Can you pay for their services? You know, and if you have insurance, they love you. They don't give a damn who you sleeping with. They love you.
Well, I found when I do ask questions, they're almost intimidated by the fact that I am asking questions, and in response to that, I don't feel like I get a good response from them because they're hesitant in feeding me information as if I shouldn't know.
The doctors have their own little club, and how they talk to you on a certain level. A lot of doctors deal with you like you don't know anything, so why even bother to explain it to you? You're not going to get it. You know, you're a woman of color. You don't have any health insurance. I'm seeing you on charity. I'm not getting paid. I could be golfing. What? Yeah, it does. And so it's a legitimate concern to walk in and wonder just how you're going to be treated, even if you've gotten a great reference from Susie or Annie or somebody. You still wonder.
But that's what keeps me hesitant as far as going in, because these incidences, I actually had one doctor yell at me and tell me that, you know, referred to me as you and that other one of his other patients. And I asked him, I said, well, what are you referring to as me and the other one? You know, what does that mean? And he could not, he goes, oh, I'm sorry, I should have never said that. No, you shouldn't have, and I had to get up and walk out. You know, and I thought, well, that really put a damper on me, thinking this person was supposed to be in a professional atmosphere, and yet he's yelling at me because I'm asking him questions that he should be capable of answering.
I remember when I was really young, in my 20s, I had a really bad experience with feeling disrespected at the hands of, you know, the medical staff. And it kind of traumatized me, so that it did kind of implant a fear or a bad feeling having to go to a doctor's office, feeling that I would not be respected. But I'm older and more assertive now, and I have more power, personal power. So what I would say to a person who hesitated because of fear of being embarrassed or humiliated, is to take someone with them so that they can speak up for them.
You know what we are? We're all humans. And we all have to speak up for ourselves. If we're going to go get a mammogram right now and they're squeezing a little bit too much, let them know. A lot of them, like she said, they're on a timeline, but they're more careful with you now because there are more women getting mammograms than there ever has been. So speak up, open your mouth. That's the only thing that you really have to do. Let them know, hey, this is a little too tight. This is hurting. And explain. And they'll work along with you, I'm really sure.
Yeah. Everybody's not like that. Everybody did not have a great experience going to the doctor's office. When I had my first mammogram, the technician was so rude, I didn't want to go back.
But it's fine to go ahead and, feel like you want your rights protected, but not at the cost or the risk of your life.
That's right.
I
and your
understand
health.
that.
So it's, even though you may have to deal with doctors who are not sensitive to your feelings, but until you find one that's going to respect you and be sensitive, you really need to go ahead and get your mammogram and get the ball rolling.
There was a point during the group that we were all trying to help Karen. We were all talking at once. We were all listening to Karen. We were even listening to the excuses that she was giving about sparing her daughter by not getting an exam. But I was sick and tired of Karen's excuses. I wanted Karen to do something for Karen.
What about embarrassment? What kind of embarrassment? Fear of being treated differently from people? And well, I'm going to move this along. Embarrassed of being draining the family, emotional. You don't want the family to be bothered, like Karen was saying. We don't really talk about it. It's kept behind closed doors. In African American culture, it's a hush-hush thing. And we want to stop the silence. I don't know if any of you heard that, us with black culture, that they don't want to go to the doctor, have a mammogram or anything because they have a fear of having cancer and have fear that when they're cut on and open up, that it spreads. Yeah. That is not true. This is all over the United States and the black culture. They say that when you're opened up, once you're open, it spreads. So don't go there and have surgery. It does not spread. That's an old myth. I'm a living witness. I know it's a myth. I'm still here after 7 years. So I know that's a myth.
I've seen people in my family over the years that were ostracized because they developed cancer. So we know that that exists, but it's much less so now than it was in the past. And getting a mammogram does not mean automatically you have cancer. Right. You're just getting tested to rule out the fact that you don't, or maybe to find out that you do. But as it was brought out, 95% of the women who get tested do not test positive. Get tested. At least if you're tested, you know what your options are.
Mm-hmm. Well, sure, we can always do something about it, but the essence of that are the individuals that are surrounding you. Are they going to want to deal with it? Are you talk about people wanting to support you. However, are they really going to be there? People you haven't seen in years want to stop by and, see what you look like. I've seen it happen. I know that.
That's true.
But if your family is negative, I hate to tell you like this, they need to go to the side. You don't need anybody negative in your life during that period of time. We don't need anybody. They should all be positive. And if anybody negative comes to me, then they can stop calling me or coming by, because I need a positive person, because I'm going through an experience. I went through the experience that they're not going through.
I had to focus on what was happening with me.
Right.
And, it's just like they were saying, you put yourself around positive people, that's positive right. things.
I was hearing some good advice, but I didn't want to be forced to go through with another bad experience with screening when I didn't feel sick. I couldn't afford to be sick. I was too busy, and I had my daughter to take care of.
ran into somebody a few days ago, and they don't have any insurance and not employed. And I was encouraging them to come in and get the mammogram. And they said, oh, but I can't pay for it.
Well, and that's another issue for me. I'm just starting this new job. I have no insurance, so if indeed something is wrong, how am I going to pay for that?
If it's something that you really want, you get it. I mean, insurance or not, no insurance. If it's something that you really want, I think you'll just go for it.
Not necessarily.
Well,
if you do
no.
not
Well,
have money and you walk into a doctor's
first
office,
of all,
you're
I'm thinking
telling
about-
me
okay,
that
first
he's
of all-
going to take the time to see you?
First of all, let's just take mammograms since we're on that subject. I think there are agencies out here that will provide a woman with a free mammogram. Period.
Sure, a mammogram, but if you've got other entities of care and you have no insurance, you're not going to be seen. Nobody wants to see anybody that can't follow up in paying them or reimbursing them.
And I
funds.
understand that.
And it's not just about the mammogram.
Right, and I understand
What's going to
that.
happen after the mammogram?
Don't get mistaken about it. It may be free to you, but the doctor's getting paid.
Right. Well,
Okay,
that's what I
so
tell
just be real
people.
clear about that.
Yeah.
They're getting paid somewhere along the way,
Yeah.
you know. And so the public health department is a great resource because if they don't know, they'll find someone who does know.
Okay. But what about the individual that doesn't have the support group and that's out there in the community that doesn't have insurance? You know, how are they attaining these resources?
Well, I'm not sure if they are obtaining the resources, but I do recommend some routes to get to them. If they have school-age children, they can actually go through their school-age child's counseling office. And that counseling office would have info for information about health insurance for the child,
Great.
as
Thank
well as the rest of the family. If they don't have school-age children, they could look at something called community information centers or community family centers.
Right.
Around here,
Okay.
that's what they're called. And they cover a wide variety of info. If they can't find one of those, then we also have our community recreation centers. In this area, there's a wide variety of ways to access these free or low-cost services, which brings me to the question of free. A lot of people have problems with the word free. Do you? What do you think about, telling someone we have free health care? They may think it's poor quality or
Exactly. I mean, is the quality of assistance and medical attention going to be the same? Or are they going to, okay, well, we don't have to send her to get an x-ray because that costs too much. Or we don't have to send her to get a PET scan. We'll just bypass that and,
I think that some of the free medical that they have is wonderful because a lot of times it's donated. The doctors who will donate their time, these are very reputable doctors, and they will donate their time because they know how hard things are now with people in medical.
I tell them that we have a program that we can cover you, if you fall in the guidelines, that it'll be free to you. I put it to them like that. This program will pay for it. Because a lot of people get turned off when they say free, Sure. So I'll just tell them that it'll be free to you.
I just want to add that I think health is something we work on every day, and what I see with sisters is this kind of do or die thing because we're usually living in survival mode.
Right.
So we're usually living from crisis to crisis. But I want to offer that taking care of ourselves is bigger than our next crisis. It's really bigger than that. It's bigger than the next broken foot or whatever hangnail. It's bigger than that. And I'd like us to think of mammograms, if we think of them, as a part of a continuum of care.
Right.
That's something that we do. There's a lot of ways to help yourself heal. Educate yourself. It may be stressful, obviously, when you're facing a life-threatening illness, but being black in America can be a life-threatening illness. So you know what? You got to educate yourself. You got to go to the library. If you can't afford the book, get on the internet. Find out what treatments are being used for your particular situation and ask questions. We no longer have to hand ourselves over to the mercy of strangers, hoping that God will work it out for us. God works things out for people who have enough sense to help work it out for themselves. There's so many choices now, and I want African American, particularly women, to take this message back to our communities and families.
Right.
Use these choices. If you don't know how to use them, find someone to teach you how to use them. Be your own advocate. Find yourself an advocate.
People like to volunteer their services. However, when it comes down to the realism of stepping into an appointment, and you do pick up the phone and you call and say, I need some help. And trust me, ladies, I really appreciate your support. But when it actually comes down to it, are you going to walk into that doctor's office with me?
Yeah.
I wanted Karen to get support by coming to the group today, but I can see Doris is getting more upset with her. I just hope I made the right decision in bringing her here.
Do you think you can beat cancer? Is that what the deal is? Is that what the hesitation is? You know, I hear that, you know, a lot of times black women, we buy into our own myths. We can multitask, we can cook the bacon, fry it up in a pan, all that other bullshit. And we buy into our own myths. Do you think that if you do have it, you can somehow beat this, that you are a super black woman who cancer won't get?
No, I don't have my gold belt on or anything today. You know, cancer is not picky about who it chooses. You know, however, in my mind, I like to have different options because I know women have not always had to have chemotherapy in order to rectify this disease and eradicate it. So I'd like to make sure that I'm doing my research to find other options, as Mary had indicated.
Karen, are you doing any research? I mean, I didn't hear research.
You know, actually I
hear
am,
that.
but see, nobody bothered to ask
Oh,
me that
what
when
are
I
you
came
doing?
in. Everybody
What
was
is
so
Karen
focused.
doing?
Everybody was so focused on me, and I respect all of you for that advocating for me. However, I've been advocating for myself, but the experiences that I've come by in dealing with some of these physicians have not been a very positive experience for me. So I need to look into other entities of health and well-being to make sure that I'm looking at all aspects if indeed that I do have cancer.
And what have you been doing, Karen? Because we all tried to save you. We all picked up the cross and we was walking. And so what are you doing for you? And how can we help you?
By being here at this point in time and allowing me to better understand these different experiences that you all have experienced. That's how you can help me.
What have you been doing, Karen?
Actually, I've been researching. I've been reading. I have my medical book out in the car, if you'd like for me to go get it.
I believe you, sister. I just need to hear that you're doing something besides got me sitting here in this hot-ass room. I need to know that you're doing something.
I have. I do a lot of lifestyle changes. Actually, I really focus on, I don't do caffeine. I don't drink soda pop. I don't really eat a lot of red meat. I focus on chicken and a lot of fish and poultry. I try to make sure exercising and, you know, really.
Finally, I had had enough of Karen. Her excuses, her willingness to just accept what was happening to her. I just was tired of it. And I think the whole group was tired of it. She either did something or she died.
No matter what I was being told, I knew my own body better than anyone else. I studied about health, and with the help of God, I knew I could take care of myself. I told this to the women. Excuse me, you asked me earlier what I was doing to help myself out. Well, what I've had to do was I had to advocate for myself to the governor. And I had to generate a letter regarding my experiences so that other women, whether they're African American or not, can go out there knowledgeable to these different types of experiences that I had to try and avoid that. And I wrote the Medical Association because I'd hate to see the person that didn't have a group like this that was advocating, you know, for women in general, especially African American women, not having that resource, because I found that fighting by myself was really tiresome. It was extremely exhausting.
Now, can you imagine if you took that energy and walked yourself onto the doctor and went and got this exam, this follow-up? Can you imagine what an advocate for yourself you would be? Damn, I'm excited just sitting here. My mom died of breast cancer. She's the same age I am right now, 48 years old. And what makes me think when you talk about your daughter is that my mom, she went in, she got the mastectomy, she did all, but she didn't do any follow-up care. She thought she could beat this cancer. Why not? She had beat everything else in life. You know, she had fought. She's a strong black woman. She can beat this cancer. And it wasn't until we were cleaning up her house and packing up her stuff, and all these letters were from the doctor's office saying, come back in for chemo. Where are you? We're trying to reach you. And to think that I really was angry about it, and now I'm just hurt behind it because I thought it was kind of selfish that she did it for her. Not for the, 5 brothers, 4 sisters. She didn't do it for us. she decided that she was going to beat this cancer. So now I got to pack your damn house up and say goodbye to you all over again. So I would say just keep that in mind when you're saying that, you know, I'm telling my daughter to read this book. Better a book than an obituary. Decide what you want to do and do it. It's much larger than who you are. I have a lot of clients who, you know, they want to blame the system, they want to blame the man, they want to blame everybody, they want to blame God. And I'm kind of like a tough love kind of person, you know, so I don't have a lot of tolerance for that. You know, you deal or you die. You have those are my choices for you. Okay, now if you want somebody to advocate for you, if you want to deal, I'm your girl. But if you're going to sit in the corner and blame everything in the universe, I got things to do and people to help. And so, you know, that's what I would offer you. You and I would go. I would go with you. I'm not a white woman, but I'm an aggressive sister. And we would get some answers before we left that doctor's office. And if we didn't get answers from him, we get answers from his daddy. We're going to get answers. And we would get what we need, you know, and we would get what we need. Your life is that important to me. And we would go to the doctor and take care of business together.
I'm going to hold you to that, too.
Oh, she good.
We as black women are caregivers. And we are caring for everyone else but ourselves. We care for this person, that person. We will run the last mile. And we all know that we need to care for ourselves. We can't do anything for anyone else if we're not there to care for ourselves. So first comes ourselves right now.
Doris, I'd really appreciate it if you could come to my next appointment with me. Would that be okay? You know, information, because we very seldom do that as black people.
Well, that's true.
Now that I was here, I wondered why it took me so long to do what was right for me. So I guess we're going to be going in. I don't know if I really want to do this. I knew I should have come back. And all I needed was the help of a new friend to restore my courage. I was still a little scared, but I wasn't afraid.
You know, and all life is about living, loving, learning, you know. I can tell you this. I wasn't sure we would make it at first, but together we found a way. Sometimes you need friends to overcome your fears or to at least help you face them.
You might have the time, but what if I don't want to go in here and do this? It just doesn't make sense to me to go in here.
Well, we're here, and we're going to get tested. And we're going to live happy ever after.
Come on, I'll do it.
All right, let's do it.
Hi.
Hi there.
I'm Karen Smith, and I'm here for a follow-up.
Oh, okay, nice to see you again.
Thank you.
Okay, just have you fill out the front page, and when you're finished with the information, you can bring it back up to me.
Okay,
thank you.
You okay?
Yeah, I think so. I just want to get it over with. How long does this take?
You should expect to be here about 40 minutes.
Okay.
I'm really proud of you.
I surely hope they don't find anything.
Karen, come on back. We're ready for you.
Thank you.
Hi, Karen. I'm Kathy. I'm going to do some additional imaging today. This is going to be pretty quick, and I'll talk you through everything that we're going to do in here. Just sit your things here, Karen.
Thank you.
And we'll have you just slip on this robe, undress waist up.
Okay.
I'll step out while you do that, and I'll come back in and we'll finish up.
Okay. Thank you, Kathy.
You're welcome.
That worked out good today. It wasn't as bad as I thought it was going to be.
So you're glad you went?
Yeah, I feel kind of silly that I acted so ridiculous.
Don't feel silly. I'm just so glad that you came.
And I'm so glad that you supported me with this. I remember telling the ladies in the group that I had to protect my daughter and that I wanted to enjoy life to its fullest and just not know of any problems. Now I know I'm helping my daughter when I'm helping myself. And that knowing about my health is the way to enjoy my life. And it feels so good.
I remember the day that I found out that my mother was dying from breast cancer. it was too late to do anything to help her. She had allowed cancer to make all her decisions by refusing to go back. I'm pleased to know that Karen's daughter will not have to face that day.
And for each and every individual, and bless their home. In Jesus' name, amen. I think everyone has courage inside, but we need some help from others to bring it out. Help is there in your community, your family, your friends, and in people you don't know yet. If you're watching this, you have friends close by. Get to them. Get to a group. Help yourself, and you will have help those you love.
Taking care of yourself is more than one health screening. It's a way of living your life. And one of the greatest things you can do for yourself is to show yourself how much you love yourself by getting a mammogram, creating that support group. If it doesn't exist the way you saw it today, it exists right now in your office, in your church, at your temple, or with the women you know who live next door. Take care of yourself, love yourself, go and get the screening.
Ignorance is not bliss. Not knowing is a dangerous thing. Go and find out. Know one way or another, then you're in control of the situation.
And just remember, cancer is not a death sentence.
If you truly love yourself, then do the ultimate gift for yourself and go get tested.
Treat yourself like you're the queen or the king on earth, and take a friend.
Have you had your mammogram? If you're worried about the cost, or you don't have insurance, and if it's a problem for you, call the Community Health Access Program at 1-800-756-5437. Ask about the Breast and Cervical Health Program. To request a copy or a showing of this film to your group, call Jody at Public Health at 206-263-8200.